All right, ladies and gentlemen, welcome to another episode of James's Corner. I am your host, James Richardson. And before we get started, I invite you guys to subscribe to the channel, share these episodes with your family and friends. Today, I have a very special guest, Sarah Joy. She is a CF advocate and warrior in the community, and she's also a transplant recipient as well. Sarah, thank you so much for joining me today.
Yeah, absolutely. Excited to be here.
Awesome. Well, I appreciate you coming on once again. Can you just introduce yourself to the audience and tell us a little bit about yourself, where you're from, kind of what you've been through in life? We'll start there.
Yeah, oh, that's big, that's heavy. But I'm Sarah Joy. So I live near Atlanta. Uh, and CF for me, I was diagnosed at 6 months. When I was growing up, I didn't really have a lot of CF lung involvement until I was like 14. But once I started to have lung involvement, obviously it progressed, and I ended up needing a double lung and liver transplant in October of 2019.
Wow. And you were diagnosed at what age?
6 months.
6 months. So you've lived with CF your entire life.
Yeah,
Gotcha.
yeah.
Gotcha. And you said you had a double lung, and I think did you have a liver or a kidney transplant as well?
Double lung and liver transplant.
Wow. Okay. So let's talk about from the
Yeah.
beginning. Let's talk about your journey kind of being sick with CF. Like, how was your childhood into your young adulthood and becoming an adult with CF? Can you just start in the beginning for us?
So I grew up, I had three brothers, so
Wow.
you gotta be durable.
Right?
You gotta be tough to do that. So growing up, CF for me, it was things like, oh, I have to take enzymes before I eat. Uh, and it was also, I had a really bad sinuses, I still do. But I had a lot of sinus cleanouts and surgeries. So I've had over 100 sinus operations in my life.
100 sinus
So
operations?
yeah, I'm a little famous in the Southeast with the ENT. Um,
Wow.
but yeah, so for me, I think CF was having to leave school to have a surgery, and then maybe the next couple of months kind of getting over that surgery and doing a lot of IV antibiotics at home, oral antibiotics.
Mhm.
That's kind of what CF was for me whenever I was in elementary and middle school. And then when I started high school, my lungs, I started to have dropped in my PFTs. So it was then starting to come into hospital stays for, tune-ups, the 2 weeks, and you do your IVs and go home and try and get better. And at first that was something that only happened like once or twice a year. I graduated from high school on time. I went off to college. I lived away from home. And then I started grad school. And while I was in grad school, that's when I really started to notice more involvement with the lungs. And my hospital stays started to go from a couple times a year to several times a year, where maybe I was only having like 3 weeks in between hospital stays. And the big thing that happened is no, the lungs weren't great, but I looked like I was about 9 months pregnant. And that was because of my liver. My liver was failing. I had gained about 30 pounds of just fluid on the
Wow.
belly. My legs were ballooned up. Even in winter, I was like, I can only wear flip-flops. And that was, if you were to ask me, how do you feel? It wouldn't be so much, oh, I'm having trouble breathing. It would be pain in my back and my stomach.
Mm.
Living with like a heating pad and not being able to walk far, just because of all this extra fluid on my body and the energy that was just kind of zapped from me.
Yeah, I can imagine.
Um, and so whenever it came time for transplant, I'd always kind of known that I would need a liver transplant at some point, but no one had really mentioned lung transplant, which is
Hmm.
maybe weird in the
Yeah.
CF community to not really have that mentioned. But um, when my doctor brought it up to me in January of 2019, he was like, "Hey, yeah, it's getting time where you're in the next 5 years going to probably need a liver transplant, but we would do your lungs at the same time. And that really shocked me. I guess I'd had a few years to kind of get used to the idea of a liver transplant, but lung transplant, it just seemed like a completely different beast.
Yeah.
And that scared me. Liver transplant didn't scare me. Lung transplant, that scared me a lot.
Yeah. It's
And
terrifying.
yeah, yeah, it is. And because it was going to be a multi-organ transplant, and what the liver needs post-transplant and what the lungs need post-transplant are often very different things. My doctors here in Atlanta were like, we want to send you to a different hospital. So I went to Duke. And they were like, they've really got it dialed in on what the lungs and the liver need. And so then it became not only was it going to be the surgery, but 7 hours away from my home with all new doctors and, trying to coordinate a move. And that was a lot to hear in January of 2019. Um, and actually, they did not send me to Duke. They told me that I could choose, which was really overwhelming. Because obviously I have an English degree. So I'm not gonna know where to go.
Yeah.
And I ended up asking Google, and which is a very millennial thing to do
Yeah,
probably. But
right. Yeah,
I was just
exactly.
like, hey, and it was like, yeah, I don't understand the question. I was like, me either.
Yeah.
Um,
Wow. Even Google couldn't answer the question for you.
right, exactly. But it was, I ended up, whenever I started looking into it, there was a CF couple who chronicled their life on YouTube. And she actually was at Duke being tested for the exact same kind of surgery. And I was like, oh, wow, okay. And I watched some of her videos and got to see her go through the eval process. And I
Hmm.
was like, well, okay, this helps me narrow it down.
Right.
And yeah, so we were still operating on the idea that that was going to be within 5 years, but I was told about it in January. And in July, I went up for my evaluation, and October 7th, I was transplanted. Um,
Both at
the
the
whole
same time. You
surgery.
did the liver and the lungs at the same time.
Yeah, they like to do that because that way it's a little bit easier as far as uh, not having too many antibodies in your system, and more organs from the same organ donor is a better chance of the organs not rejecting.
I see. Okay. Okay. Well, that's a lot there to unpack. Let's unpack some of that.
Yeah, sorry.
No, it's okay. That's perfect. Let's unpack some of that. So I'm just a little bit curious. You said that well, the fluid was retaining in your body, right, from the liver. Can you just break down on what was like happening to your body? Because for people that don't know, what was happening?
Yeah. So your liver filters, and as it was weakening, years of like heavy antibiotics for sinus infections and lung infections and things like that. The body just, or the liver, it just started to get weaker and from having to do all of that. So it didn't do as good of a job of processing, and so this fluid just sort of would build up on the abdomen. And with CF, you always have bloating and things
Yeah.
like that. So it was often hard. I would be like, well, I don't know. I don't really know why my stomach is always big. It must be like something that I ate. But then my legs would start to balloon up. So my calves would get really big. I was having to wear compression socks and things like
Wow.
that. Um, and basically, it got to the point where if I woke up in the morning and I stood up, within an hour, it would be painful to walk because it just felt like my skin was going to split.
Yeah, because of all the
Um,
pressure, right, from the fluid.
right. And I'm 5'3", and usually a very tiny person. So when you suddenly put 30 pounds of fluid on me, um, it's really difficult to move around. So
Yeah.
no wonder like my back was killing me, my
Right.
stomach was killing me.
Right.
And you start taking different like water pills, like Lasix, to try and get some of that water off. But one of the side effects of that is then we start throwing the electrolytes off. So
Mm.
then we started getting really bad body cramps.
Oh, yes.
So it's one of those things. It's like you do one thing to get a little bit of relief, but you're adding on
Yeah.
three other things at
Yeah.
the same time.
Awful. Awful. It's always like that. It's always one thing and then another thing and then another thing.
Yeah, it's always a spiral. There's never like a hey, do this and
Yeah.
it's great. It's always like, well, sacrifice these other
Yeah,
things.
exactly. Exactly. It's
Yeah.
awful. It's awful. And how long did you deal with that? Like, how long did you deal with the fluid building up in your body? Like, how long was this process until it got fixed?
So it was sort of a slow thing. I would say in 2015, I started to just notice like bloating that wouldn't go away. And again, it was hard, figuring out what that was exactly, but we'd notice it would might get worse whenever I was doing IVs, so being on antibiotics, and my liver enzyme levels started to get really elevated. Um, and gradually it was just like, hey, this is extra fluid on your body. Like my doctor's telling me that, and starting out with water pills and going up on the amount, and then finally realizing, okay, you're just always going to have some level of it. And it was it was funny, but it was also terrible. It kind of depended on what mood I was in. But if I went to the grocery store, people would be like, "Congratulations," and I would be like, "What are they talking?" And everyone, it genuinely did look like a pregnancy belly.
Wow.
I
What would
mean,
you
it
tell them? What would you tell them when they said that? Would you just kind of go with it just to avoid the
so
conversation?
in the beginning, it was like, "Oh, thanks." It was just kind of like being polite, but by the end, I was pretty over it, and
Yeah, I can imagine.
yeah. So I do remember like being at the grocery store, my partner and I, and we go through the line, and the cashier was like, "Oh, are you hoping for a boy or a
Oh my
girl?"
gosh. This is
And
crazy.
he and I just looked at her, and we both like in unison, we were like, "A liver," and then we just walked out.
Yeah,
And
yeah, yeah.
yeah, towards the end, I would try to use it to educate. Like, actually, I have cystic fibrosis and I'm an end-stage liver disease.
Yeah.
But at the same time, like some people were genuinely nice,
Yeah,
and you can tell, and other people,
right.
it was just like, so it depended on my mood.
Gotcha. Gotcha. Well, thanks for sharing that. So you have this, let's talk about the transplant process of how that worked out. I mean, I've interviewed a bunch of people with that have had transplants, and everybody's story seems to be different when they're going through kind of similar, the same thing. So I'm interested in your perspective of how you felt during the process, what you felt like when you got the news in the beginning, and then what it was like the experience during. Can you just run through that for us?
Yeah. Yeah, so for me, I still feel like everything happened so quickly. In January when I was told about it, we were all like, "Hey, this is on your 5-year plan." And so I think in June, Duke got in touch with me, and they were like, "Hey, you can schedule, there's no rush. You can schedule your evaluation anytime from 2 weeks from now to Christmas." And they were like, "A lot of people like to do it around Christmas because they're already off for the holidays." And I have anxiety like no other. So I was like, "No, I'm getting this done and off my plate."
Yeah.
Still thinking this is in my 5-year plan. And so I was like, "Well, can you give me the soonest available?" So at the end of July, we, my parents and my partner and my younger brother, I think I'm trying to think who all went up the first day, but we kind of traded out throughout the week. But I went up there, and it's several days. There's all different kinds of tests. And obviously, the whole time I'm there, I'm like maneuvering in with my big old belly.
Wow.
And I think one of the doctors was like, "Oh, I didn't realize you were with child." And I was like, "I am not."
My gosh, the
Um,
doctors are even that's the
yeah,
doctors are
right.
nuts.
And I was like, "Actually, this would be my liver."
Man, that's crazy.
Uh, yeah. So, and everyone, when they saw, my belly, everyone was kind of just like, "Whoa." They were like, "This is really bad." And
And what can sorry to interrupt you, Sarah. What could happen if you didn't take care of that? The liver would it explode? What would happen to your body if like it just kept the fluid kept building and building and building.
So the big thing that I noticed is you sleep all the time. Um,
Yeah.
and that is because your liver filters, it's not filtering out those
Yeah. It's
toxins
our
as well.
processing system, right? Like it gets everything out. Yeah.
Exactly, exactly. So, um, just really lethargic, sleeping a lot, and eventually what can happen is you there's a proper word for it, and I'm it's lost on me right now, but your blood just kind of gets a little bit poisoned from it,
Right.
and your thought process, everything gets really foggy. And so the other thing that you do is you do these stomach taps, where basically they insert a needle into your abdomen and they drain off fluid. And we were getting 3 liters of fluid off of my belly, and then 2 days later, it was all back.
Wow.
Um, so yeah, whenever I went up there, they obviously, I think that belly really shook them. And, for me, it's something I kind of adapted and had lived with. But for them, it was like, this is not okay.
Yeah.
And they reached out and they said, we think that you are in your window. So the window is when you are too sick to live without new organs, but not too sick that you won't have a good chance of surviving the operation. Um, and again, we're going from this is in my 5 year plan to, hey, this is in your 5 weeks.
Mm.
Um, so that was something, basically the last day of my evaluation, they had recommended like you should be looking for apartments and stuff in Durham. So
Yeah, because you have to move to the place, right?
yeah, yeah, we've got to move. So I think my last test was some kind of MRI that they needed, and we went and we looked at one apartment complex and started the paperwork for it. We moved or drove back to Georgia and
Wow.
just started preparing. And so I was moved in by Labor Day weekend. My mom and I made the move, and my dad, my partner, they obviously had jobs and everything that they needed to stay for. And so I moved up there September 1st, and the stress of the move was really hard on my system. I ended up doing 2 trips to the ER just in the final days of the move. Got up there, and within a week, I had to be admitted to the ER at Duke. And I thought, oh, they're just gonna give me IV antibiotics like normal, and I'll go home and I'll wait until I'm officially listed for transplant. And they walked into the ER, and the doctor just looked at me and said, "You're not leaving here until you have new lungs and a liver." And I was so dumbfounded. I was just like, I'm not going to leave for like a year because they had told me this process could take a year.
Yeah, yeah.
Um, and I was just like, what? And my mom's like, no, no, like they think you're sick enough now.
Wow.
And
Did you
it was
feel
weird.
sick enough? Did you feel like that you knew it was coming, or how did you feel like internally?
I knew that I was tired and exhausted. But at the same time, I had felt that way for,
Yeah, you were used to that feeling.
right, and for a couple of years and really intensely for all of 2019.
Wow.
But I wasn't on oxygen, and there were just certain things in my head that I was like, you only need a
Uh-huh.
transplant if you can't get out of bed at all,
Right.
or if you're on oxygen. So there were these things imposter syndrome was really strong. I was just like, are you sure? Like
Yeah.
someone else probably needs it more. Um, but I was admitted to a room, and we immediately started turning to how to get me ready for transplant. And the biggest thing was I needed to gain about 11 pounds. So
So
I
they
was
wanted you
given,
to gain more weight to get the transplant?
yeah, so I was barely eating because my stomach was so
Right.
full. I was just like broth and soup was all
Oh
I
my
could really get
gosh. How
down.
long did this go on for? How long was that period of time?
Um, all of 2019, January of 2019 until I got up there was probably the worst.
So a whole
Where
year
my
you dealt with the
appetite.
stomach thing.
It was about, I would say from 2015 to 2019, it was a slowly like getting worse thing. And I would probably say 2017 to 2019 is when everyone just thought I was pregnant.
Wow.
That because it was just so big and it didn't matter what I did. And that whole time, just my appetite was getting less and
Hmm.
less.
Hmm.
But I think we figured out that my actual weight was somewhere around like 80 pounds.
At that time.
But right, but then you add on, every time you get on the scale, you're way above that. And so they wanted me to gain weight. So I had a feeding tube. Um, and there are all these classes that you're supposed to take prior to transplant, you and your caregiver. But because I was admitted, they were like, sorry, you're not going to get those. You're just going to learn kind of on the fly.
What are the classes for?
So learning about your anti-rejection meds, learning about how to, uh, infection risk,
The knowledge
how
kind of the
to,
transplant.
how to manage your medications, and um, which, for CF, it was like kind of good. I already had a good background
Yeah.
in some of those things. But there are some people there who they've never really, they don't have a lifelong illness. Something has gone wrong with their lungs and they need
Right.
a transplant. So my mom was leaving the hospital to go attend those caregiver classes. And meanwhile, they were like, you've just got to get as strong as you possibly can. And so I was doing laps like all around the hospital. And that was mainly what I did day to day. And I got listed officially. I was still underweight, but they went ahead and listed me because my lung team was like, she's going to miss her window for having healthy lungs. The liver team was hesitant because they really wanted my nutrition up before the surgery. And I got listed on October 1st, and I had my transplant on October 7th.
Wow. So it's pretty quick.
It was so quick. Whenever I hear other people's stories, I'm amazed at how quickly my whole process went. I feel like I didn't have a lot of time to sit there and really worry and imagine terrible things
Yeah.
because I was just moving
Which
so
is a good
quickly.
thing in a way, right? Which is kind of a
Oh
little bit.
yeah, yeah. It was great because you know I didn't have time to get bogged down. I'm like, well, what happens if this goes wrong?
You start the reeling of the mind starts going.
Yeah,
Yeah.
I would recommend that would probably be the best way to do it.
Yeah.
Uh,
Like a
now I
band-aid.
know too much. If I have a second one, I'm like, oh wow, I'm going to be a deep dive.
Yeah, absolutely. What was your lung function when they did the transplant?
I was trying to remember that earlier. I don't remember what it was. I know I had gotten down in the 40s and maybe high 30s.
So was your
Um,
breathing pretty bad? Like, did you feel like you weren't breathing well, or you were more focused on the liver?
um, Main focus was on the liver. I
Yeah.
remember that sort of that month before that September, whenever I was admitted at Duke, they kept putting a nasal cannula on me. I was like, I don't need that. It's like I don't need that.
Yeah,
And they'd be
yeah.
like, yeah, you do. We're looking at the monitors.
Damn.
And so the lungs really had started to tank. And I was sleeping so much of the day because my liver was so bad. Um, and I remember like if my oxygen, if it fell off of my nose, it would wake me up and that was the first for me. Um, I'd never really experienced kind of being like oxygen hungry.
Yeah. Wow.
I had experienced my main thing that I would say that I experienced was hemoptysis, coughing up blood. That was something that I did a lot of, and would have to go in. They would have to go in and embolize different areas in the lungs to stop some of the bleeding. Um, but even that was something I was pretty used to that. In movies and TV shows, when somebody coughs up blood, you're like, well, that character's dying in the
Right.
next scene.
Yeah.
And for me, I was like, that's Tuesday.
Dang, that's
I'm
crazy.
good with it.
Wild. It's wild how
Uh,
we normalize those things.
and yeah, anything I think can become normal. Anything can become routine, and that's really the way it was with CF. They talk about like the frog and the if you drop it into a pot of boiling water, it jumps out, but if you just slowly heat it up, and
Right. It's true. Yeah. Wow, that's wild. So you had the surgery. Now, obviously, can you walk us through the process of what they do in the surgery?
Yeah, so the doctor explained to me that they would transplant the liver first. And the reason is because they wanted the good liver to be able to produce those good clotting factors to give me the best chance of not like bleeding out during
Mm,
the surgery. Because with my liver, if I had bruises all over from just if I bumped into something or brushed against it, I would get a terrible bruise.
wow.
So, which was a surprise to me. I did not realize that the turnaround time would be that quick of like, yeah, as soon as we hook up the new liver, it starts doing what it's supposed to. Um, so they said that the liver team would start. They would come in, they would make their incision, um, and take out the old liver, place the new one. They would also be doing a procedure called a stomach fun fundoplication, which is something to help prevent acid reflux, which can lead to damage to the lungs and rejection. So they did those two things. And then the lung team steps in and they make an incision. For me, I've always thought it would be like this,
Right,
but they
right.
did one just a clamshell incision sort of under the breast. And they basically told me that they would lift my chest open like the hood of a car, and they would take out the old lungs and place the new ones.
Brutal.
Um, and as far as I know, that's what they
Yeah.
did.
How long was the whole process? How long were you under for?
Oh, let's see. I think around three, or sorry, around like noon, I was taken down to the OR. I think the surgery started sometime around three, and I think it ended sometime around three the following morning.
Oh, so like 12 hours?
Yeah, it was a long surgery.
Wow. And when you woke up from this surgery, can you tell us some of the first thoughts you thought, or what was like your experience with that?
It it was terrifying.
I could imagine.
Um, I I had seen this video. It's a beautiful video of this woman waking up. She has CF and she wakes up afterwards and they pull the breathing tube. And this look that she has is like it's just a beautiful moment. It brings tears to my eyes. And
Yeah,
that's
absolutely.
kind of what I when I go into surgery, I'm thinking that's gonna be me.
Yeah.
Um, no. So when they woke me up, I could not feel anything. And I didn't know I could hear, sound is the first thing that comes back. And so I could hear voices, I could hear Todd, and I could hear my mom, and I could hear a nurse saying that they were going to take out the breathing tube soon, that I was doing
So you
well.
could hear that while the breathing tube was in your mouth, in your throat.
hmm
Oh, okay.
And because I know what has just happened to me, I'm like, well, am I breathing better? Like, how does it feel to breathe? And I realized I'm not breathing. And I was trying to take a deep breath and I couldn't. I was trying to blow air out and I couldn't. And I immediately I could move my hand and I just started shaking my hand. And Todd came over and was like, he's like, hey, you're okay. They're going to take out the breathing tube soon. You can talk. And I just kept gesturing. And finally he said, I think she wants something to write with. And they had like a whiteboard. And so I wrote out, can't breathe. Um, because they kept saying that they were about to take this breathing tube
Oh
out, and
man,
I
that
knew
must have
that
been
I
so
was not
scary.
breathing. And the nurse read it, and she immediately came over to me, and she was like, "Sarah, you're breathing." She was like, "They damage the nerves when they do this surgery." She's like, "So you're not able to feel air moving in and out of your lungs right now." She said, "But I promise you, you are breathing."
Wow, that's
And
terrifying.
yeah, and
You think they would tell you that before, maybe?
right. Well, it's weird. There's so much that I didn't know
Yeah.
before. And afterwards, I was like, I'm filing this away.
Yeah, right. That's
Um,
terrifying.
yeah. And I really freaked out. And sorry, my little dog
No,
Evie.
that's okay.
But I really freaked out. And this nurse pulled over this huge monitor to the bed. And my pulse ox had been down a lot. It had been a long time since it had been at a good number. And she's pointed out this 100 on the monitor.
Your oxygen level, right?
And
Yeah.
she said, Sarah, like you are breathing. That is a
That's
perfect score.
that's
And
wild.
that was my first moment of, oh, like we've just done something that's really going to change things.
Yeah.
And that was a shocking moment. And she kind of used that moment. She got another nurse in there, and they ripped out the tube, and then she said, "Look," and it stayed at 100. And I that feeling is so surreal. Like I don't,
Absolutely.
I it was hard. The thing when you have CF and they start promising like on the other side of this, you're going to feel amazing. You're going to be
Yeah.
able to do these things. It's kind of like a snake oil salesman. You're like,
Absolutely. Yeah.
it's like, okay, sure, maybe,
Yeah.
but I've
Yeah.
never
Yeah.
been able to do them. And so that was kind of my first realization that, oh, wow, we may have really done something here.
Wow. So you came out and you couldn't. Okay. So I didn't know that. I learned something new. So they cut the nerve so you can't feel yourself breathing.
Well, yeah, they damage
They
things in.
damage it. Okay.
Yeah, so you have a lot of numbness, which kind of helps with the pain.
Yeah. Yeah. Numbness
But
throughout your whole body, like your entire body is numb.
for me, it was pretty much right around the incision, and then also a little bit around the incision that they did for the liver, and around like my belly button. I didn't have like an epidural or anything that was making it numb. It
Yeah.
was just these areas where I didn't have feeling.
I see.
Um, and that slowly comes back as everything kind of knits back together after surgery. And that's
Oh,
really with any kind of major surgery with a big incision, you get that, like
I
some
see.
numbness around it
I
usually.
see. Okay. So we come out of the surgery, you're waving, you can't breathe. You write down, you can't breathe. They tell you that you are breathing, which is insane to think about that process. And then what happens after
Yeah.
that?
Um, for me, I think I kind of once I got over like, okay, I am breathing. I think I kind of went back under, kind of went back to sleep, and then a few hours later started to wake up for real. And uh obviously there's pain. And the thing that I felt for me is I felt such a tightness. Uh, and I couldn't place what it was, and a heat. Like it felt like I could feel heat radiating off of
Whoa.
me. And we finally realized later they give you so many steroids. So there's a lot of heat with that. And it's that kind of like chemical. If you've ever been on steroids,
Mm.
and you get like that flush in your cheeks, it's like just imagine that to the max. And
Heats up
that's
your body.
really, yeah, that's what was going through it, because the doctors were coming in, they were like, "Are you in pain?" And I was like, "Yes." And I was like, "But there is this heat." And they were really stumped. They didn't know what that was. And I was like, You've done this before. Certainly somebody else has complained about this."
Yeah.
But it took a while. They brought me ice packs, and we were putting that, around my body. And I'm somebody who is cold all the time.
Yeah.
So my whole family was like, "This is weird."
Not normal.
But yeah, so we're packing me down with ice. And that's my first few days is obviously really fuzzy. But the first thing that they want you to do at Duke is they're like, "You're gonna walk." So they have you walking that next day. And so around 5 a.m., the physical therapist came by, and he's like, "All right, we're gonna go walk." And I felt terrible. The last thing I felt like doing was walking, but there was also this part of me that was kind of like looking at my body like, what can it do?
Yeah.
Like what other weird stuff is gonna go on? I always say that transplant is like the weirdest science experiment I have
Yeah.
ever been a part of.
I could imagine.
Yeah.
Wow. Thanks for sharing that. So after this was 2019, Sarah, when you got this done?
Mhm. It was.
So we've been what, 4 or 5 years now. And how is your health now?
Right now, things are going great.
Awesome.
Knock on wood, always. But um, I would say that right now, like my day-to-day health is still dealing with like the CF gut, because you
Yeah.
never know what's going to go on with enzymes and like blockages, intestinal blockages, things like that. Those are still issues for me. Uh, But as far as my lungs, I'm really lucky
Wow.
that everything is doing well. And yeah, this past October I celebrated 5 years.
Wow,
Uh,
congratulations. That's awesome. And no problems. You've been healthy and everything's looking great.
yeah, I had let's see, about 6 months after my transplant, I noticed a little spot around my incision. And it was just a little pink. And then a couple of days later, I noticed that it started to get red. And the basically they wire your sternum, after they do the surgery, they put in wires, and one of those wires had gotten infected. And so
Oh,
it actually like bubbled up above the surface. And so I had to go in for about a 3 week hospital stay at Duke where they removed those wires and treated the infection. So we had to keep my chest open and couldn't close it back for about 3 weeks.
whoa.
Um, but yeah, that was the main thing that lasted. And then while I was in the hospital, I developed a really bad bed sore from not being moved and turned enough.
Yeah.
And that sort of on its own became like a life-threatening thing that kept me in the hospital longer.
Jeez.
So I was in the hospital about 100 days post-transplant.
Wow, that's a long time.
Yeah.
So like 3 months, a little over 3 months.
Right. Yeah. So I had the surgery and I was bouncing through, doing well. They were about ready to let me go home, and I had one day where I just started to feel really terrible after they had done a bronch where they'd gone in to check things, and um, I ended up just something happened, and I just could not breathe on my own. The nurses came in, and I think I ended up passing out, but they put me into like a medically induced coma for about 5 days. And after that, whenever I started to get better from that, then they noticed the bed sore. And then the
Huh.
bed sore, it got all the way to the bone. And so then we were
What?
there doing antibiotics for that. Um, and you know, when they do transplant, they talk about when you hit speed bumps after it, not if.
Mhm.
And I feel like overall I was lucky that when these different things happened, I was already in the hospital because if they had happened at our apartment, it would have been a lot of time to get me to the hospital and get me admitted.
Yeah.
So it was a long time to be in the hospital, but it felt really good when I got to come home.
Yeah, absolutely. You've been through so much stuff. Sarah, when you're going through these things, this is a deeper question. When you're going
Mhm.
through these things, what do you rely on for your strength? How do you get through these things? Because what you're explaining, I mean, you've been through so many things and you survived it all. A lot of people don't survive what you've been through. And can you just tell us, like, what do you think the answer to that is for you? Like, what do you rely on? What do you lean on during these times when you're facing, you're facing death and you're facing it huge surgeries and you've had over 100 sinus surgeries. So how many surgeries have you had total?
Ugh. It may be in the 120s,
Okay, so over
maybe.
120 surgeries, which is insane. Like that's crazy. And if you think about, I mean, not to the average person to think about even having one in their lifetime, you have over 100. And
Hmm.
so what do you rely on for help and strength to be able to keep pushing through? And then obviously you're still around. So why do you think that is? Like,
Um,
can you break that down for us personally of how that works for you?
yeah, so my family first, my parents and my brothers, my parents have always been like, you can do what anybody else can do.
Yeah.
They've been wonderful to me my whole life.
Awesome.
My partner Todd, he is uh with him there's a future and there's all of these
Yeah.
wonderful things that I get to do now and that I see us doing in the future. So I think a lot of it is leaning on my support system, my friends as well. Like that is to me that's one of the make or break things is if you do not have a good support system, this all gets a lot harder.
Oh yeah. Change it.
Um, I think my faith for sure. I believe in God, and I had so many things happen along my transplant that I just felt like were these little signs that okay, you're where you need to be. One of the biggest is when every surgery before I go to sleep, I say that I want to hold the surgeon's hand when I fall asleep. And I always do that because sometimes you meet your surgeon, 5 minutes before the surgery. And
Yeah.
to me, I just want that human connection for just
That's
a minute. Hey, I'm a person
yeah.
right before we do this. And different doctors are always like, okay, this is weird. But when I was on the table waiting for my transplant to start, I overheard a woman say, do not put this patient to sleep until I am in the room. I hold all of my patients' hands. And I leaned
Wow.
over to the guy. He was like doing like the arterial blood gas, and I was like, "Who is that?" And he said, "Oh, that's your liver surgeon." Because the liver surgeon that I was supposed to have, I ended up not having because of a scheduling thing. And to me, that was God Himself could have walked into that OR, and
Yeah,
it would not have been the same level of
absolutely.
comfort as that moment. And
Yeah.
I just especially with somebody who's anxious and always second guessing everything, I just felt like I'm right where I need to be.
Yeah, that was his confirmation for you that you're
Yeah,
gonna be okay.
yeah,
Yeah.
I felt like it. And so yeah, I think having a good support system and for me, faith was a big part of it.
Yeah.
But I am also like can be kind of sarcastic with my faith. So on my bad days, I'm kind of like, oh, really, God, we're doing this now. Like, fine, that thank you. I
Yeah,
really
yeah.
wanted to do this today.
Yeah,
So,
yeah, yeah.
but
I
yeah,
see.
I would say those are the biggest things.
Awesome. Well, that's great to hear. And I'm glad you made it through. And if there's anything you could tell like people that are watching this that maybe are going into a transplant, I can relate to your story in any way, what would you kind of leave them with that you've learned through this process?
Um, One of the things I remember when I was walking the hallways before my transplant, I was meeting people who they were on the other side, they were recovering. And they would ask me, like, what number transplant is this for you? And I would be like, well, I guess I'm getting two lungs, and I guess it's three. And they were like, no, like, is this your first transplant? And I remember telling them, like, I'm only doing this once.
Mm,
And they kind of would laugh because I didn't realize that a lot of people need seconds or even thirds.
wow.
And that was something on my hard days I really struggled. And I would think, what, you know, I'm going through all of this really bad time right now. Like, this is miserable and I hate it. And I just want to go home. I want to give up. And I would think, what's on the other side of this? Like, once I get out of the hospital, once I start to heal, what is on the other side of this that makes these people come back for a second transplant? That makes them say, I'm game, I'm doing it, I'm coming back. Like, it must be something so good, something so wondrous that they fight for it
Hmm.
again,
Hmm.
and knowing what they're up against and they come back.
Yeah.
And so I think to me, I would just remind people why you're doing it. And, you know, whether that's for your family, your friends, for yourself, but constantly, like, as you go through this process, think of why you're doing it. Um, and also find people that you can complain about your bad days
Right.
to.
Yeah.
Um, the one thing that I wish someone had told me prior to all of this was about all of the bad days.
Yeah.
People are like, oh, there were good days and bad days, but who wants to focus on the bad days? Well, I would have liked some warning, and to know that it's okay to have those kind of feelings. Like, you don't have to just say, oh, wow, I got a new lease on life and everything's perfect.
Absolutely. Yeah, you have to have that. You have to have somebody you can share your pain with.
Yeah. And I had a social worker at the hospital who she said that transplant is not going to be the answer to all of your problems. If you had problems prior to transplant, they're all going to be there, but it gives you time.
Right.
and uh, you can do a lot with that.
Absolutely. Well, Sarah, I thank you for sharing your story today. I always do this with my guests at the end. Is there anything that you want to ask me or share before we leave? Is there anything you want to leave with?
Um, well, I'd love to know, you're doing this podcast. What was your motivation for doing that?
Well, I'm a CFer as well.
Hmm.
Yeah, and I just wanted to give a platform to people to share their stories, not just because they're famous or have a lot of following. Just I think that everybody deserves to share their story with CF. Without, I do, people with every kind of story. I'm interested in the human condition, and I'm interested in people's depth of how they feel things and how they get through things. And I think it's important to give a platform to share, allow people to share their stories and with no limits and just tell the truth about how they really feel. So that's kind of why I started it. It's small now, but we're just going to see what happens with it. So that's kind of where I'm at with it right now.
Yeah, I think that's great because there's so many different stories. I mean, even just us talking about transplant, there's
Yeah,
a million different ways that you end up on the list and a
exactly.
million different ways that it affects you. So
And how
I
we
think that's
process
really
it.
important.
Yeah,
Yeah.
absolutely. Well, Sarah, I appreciate you coming on. And I think you did a great job today. I'm going to close out the show, but I'll make sure you know all the details of everything that happens after the show when we get off. But thank you guys for watching. Sarah did a great job today. Please. Oh yeah, Sarah, how do we find you on Instagram, YouTube, Facebook? Do you have what's your social medias for us to find?
Yeah, so Instagram, Sarah Joys of CF. And you can find me there.
Awesome. Reach out to Sarah, shoot her a nice message if you can, share her episode, and please subscribe to the channel. And we will see you guys all next week. Thank you for joining us.